Good afternoon. Welcome to today's national webinar presented by SAMHSA's Game Center with the support of SAMHSA, which is the Substance Abuse and Mental Health Services Administration. Today's webinar is Finding the Way Home, Accessing Resources to Support Justice-Involved Individuals in Reentry. Our presenters today are Dr. Richard Cho, Dr. Aisha Delaney-Brumsey, Charles Francis, Christopher Galley, and Janae Jenkins, and I will introduce them shortly. I'm Dr. Melissa Stein. I go by pronouns she, her. I'm a Senior Research Associate at SAMHSA's Game Center and Policy Research Associates. You will see a chat box icon at the bottom of your screen. Please feel free to enter in the chat box, introduce yourself, share where you're joining us from. Before we start our presentations, I have some introductory items to review. First, the views, opinions, and content expressed in this presentation and discussion do not necessarily reflect the views, opinions, or policies for the Center for Mental Health Services, the Center for Substance Abuse Treatment, the Substance Abuse and Mental Health Services Administration, or the U.S. Department of Health and Human Services. If you have any questions for the presenters or in regards to the technology, please type them into the Q&A pod found at the bottom of your screen. At the conclusion of the presentations, we will address as many of your questions as time permits. We'll also be conducting a couple of polls throughout the event and really appreciate you participating in them. When you see a poll pop up, just select and submit your responses. And you should be seeing a poll pop up right about now before we move to the next slide. Today's webinar is being recorded and slides will be disseminated via the Games listserv following this event. And we'll also notify you when the recording is posted to SAMHSA's YouTube channel. A certificate of attendance will be available for download at the end of today's webinar. Please note this certificate is for your personal portfolio. We are not able to offer CEU credits. We have the ASL interpretation for today's event. Our interpreters today are Paige Bixby and Kip Opperman. We also have live captioning for our event. To view live captioning, click Live Transcript CC, then select Show Subtitles. Just a quick look at our agenda today. Coming up next, we have John Berg from our lead office at SAMHSA providing some opening remarks. We'll also then hear an update from Dr. Richard Cho with the U.S. Department of Housing and Urban Development, followed by presentations from the Council for State Governments, Justice Center, the Ohio Bureau of Community Sanctions, and the Corporation for Supportive Housing. We'll close with some time for Q&A. Now I'd like to turn it over to John Berg, who is the Senior Public Health Advisor at the Center for Substance Abuse Treatment at SAMHSA for his opening remarks. John.
Thank you, Dr. Stein, and welcome everyone to today's webinar, Finding the Way Home, Accessing Housing Resources to Support Justice-Involved Individuals in Reentry. As always, we appreciate you taking time from your busy schedules to participate in today's webinar. SAMHSA is pleased to provide this webinar that focuses on one of the biggest challenges for organizations assisting individuals returning to the community from incarceration: safe, affordable, and stable housing. Individuals with mental health or substance use disorders who are reentering the community from prisons or jails face challenges accessing treatment services, safe and stable housing, medication, employment, food, social supports, and healthcare, which increases their risk for future justice involvement. Justice-involved individuals who do not have stable housing are more likely to cycle between shelters, hospitals, and jails, so it is crucial that they receive adequate access to housing resources and supports. Having the proper housing resources in place prior to an individual's release from incarceration reduces the risk of recidivism and fosters long-term success in the community. Housing is prevention. Housing is a critical issue that is often identified as one of the most pressing barriers to successful reentry, probably because there are additional challenges for accessing housing, such as not qualifying for Section 8 housing, having a criminal history, lacking income, among many other barriers. Housing stability can affect the prospect of employment, access to services, and other factors that lead to improved outcomes. SAMHSA recognizes the importance of safe and supportive housing for those returning to the community from incarceration. So we allow, through our discretionary grant program for reentry organizations, funds to be expended for recovery housing. That's true of our drug court discretionary funding also. Recovering housing is seen as one component of substance use disorder treatment and the recovery continuum of care. SAMHSA currently has a notice of funding opportunity posted for reentry program services that closes March 6th. This is a great funding opportunity for organizations that are providing reentry services in communities and want to enhance their programs, especially those related to the provision of SUD treatment and recovery support services. The NOFO can be accessed on the samhsa.gov website and found under the Grants tab. Today, we will highlight federal housing resources and programs that are available through the U.S. Department of Housing and Urban Development. Attendees will be introduced to the HUD exchanges, homelessness assistance programs, and other resources that exist to help individuals and their services providers prevent homelessness upon reentry back into the community. Representatives from HUD, the Bureau of Justice Assistance, the Council of State Governments, Justice Center, and the Corporations for Supportive Housing will provide an overview of housing resources along with additional information about ways to effectively implement them. We are very pleased to have 5 great speakers present today on this very important reentry topic. Dr. Richard Cho, Dr. Delaney Brumsey, Charles Francis, Christopher Gali, and Janae Jenkins. I want to thank them for sharing their knowledge, expertise, and experiences with their programs. And as always, I want to thank the Gain Center and their staff for their work in developing and facilitating today's webinar. So at this time, I will return it back to Dr. Stein.
Thank you, John. And we do have such an excellent line of speakers today, but I do want to take just a few moments to introduce you to each of them. Dr. Richard Cho serves as Senior Advisor for the Housing and Services in the Office of the Secretary at the U.S. Department of Housing and Urban Development. He brings to this role 2 decades of experience at the community, state, and federal levels, building collaboration between the housing, healthcare, social services, and criminal justice sectors. Dr. Cho served previously as Deputy Director at the United States Interagency Council on Homelessness and has held positions at the Corporation for Supportive Housing, the Council for State Government's Justice Center, and the Connecticut Coalition to End Homelessness. He has a doctorate in public administration from New York University. Next slide. Dr. Aisha Delaney Brumsey oversees the Behavioral Health Division at the Council for State Government's Justice Center and its various portfolios, which focus on how parts of the criminal justice system intersect with mental health, substance addiction, and homelessness. Before joining CSG, Aisha was most recently the Director of Behavioral Health Research and Programming at the Mayor's Office of Criminal Justice in New York City. Prior to that, she was the Director of the Substance Use and Mental Health Program at the Vera Institute. She received her PhD in clinical psychology from the University of California, Los Angeles. Next slide. Charles Francis is the Deputy Program Director for Housing in the Behavioral Health Division at the Council for State Government's Justice Center. Previously, he was Assistant Director of the Leased Housing at Rhode Island Housing and Director of Policy for the Massachusetts Department of Housing and Community Development. At the U.S. Department of Housing and Urban Development, he played a lead role in implementing the Rental Assistant Demonstration Program. Charles oversees work at the intersection of housing, criminal justice, and behavioral health. He focuses on strategies for state and local partners to increase access to and availability of housing to reduce justice system involvement and facilitate successful reentry. Next slide, please. Christopher Gali is the Chief of the Bureau of Community Sanctions at the Ohio Department of Rehabilitation and Correction. He began his career as a resident advisor in the Franklin County Community-Based Correctional Facility in 1993, and he worked his way up through the Franklin County Work Release Program before joining the Ohio Department of Rehabilitation and Correction as parole officer. He's worked in several roles, including sex offender specialist, unit supervisor, administrative assistant to the Adult Parole Authority regional administrator, and all of that before joining the Bureau of Community Sanctions as assistant chief. He was promoted to chief of the Bureau in 2013 and continues to serve in that role. Next slide. And Janae Jenkins is the Senior Program Manager for the Community Transition Program at the Corporation for Supportive Housing. Janae joined the Corporation for Supportive Housing, or CSH, in 2015 and has managed their justice housing programs throughout her tenure. She has previously served as Program Manager for the Returning Home Ohio program, which provides statewide housing initiatives for people exiting state prison that have attended substance use treatment recovery services while incarcerated or live with severe persistent mental illness. Janae provides training on the important work of advancing racial equity and interventions to reduce criminogenic risk. In her current role as Senior Program Manager, she provides program management, supervision, training, monitoring, report development, and other activities that engage tenants, frontline staff, and supervisors in high-quality housing and services that adhere to evidence-based practices. So you've heard everyone who's going to be presenting with us today, and now we'll just take a quick look at our poll results and see who all is joining us today. So from our audience, it looks at like about over half of you, about 53% are joining from urban locations, about a quarter of you joining from rural locations, and then about a fifth of you joining from suburban locations. We also have several people joining tribal, reservation, Pueblo, or Alaska Native village. So thank you, welcome. And then in terms of your agency or organization, it looks like we're seeing the most of you, about 33% coming from community-based provider agencies. However, about a fifth of you are joining us from corrections, probation, parole, which makes complete sense regarding our topic today. We also have a good number of you joining from government and policy, the judiciary, public health, and other organizations. So thank you so much for taking the time out of your day to join this important webinar and to hear from our presenters. Without further ado, I'm going to turn it over to Dr. Cho to begin our presentations today. Dr. Cho.
Great. Thank you so much, Dr. Stein. It's a pleasure to be with all of you today. I'm seeing all of the different communities and agencies and people that are represented in the chat. I'm Richard Cho. I have the pleasure and honor of serving as Senior Advisor to Secretary Marcia Fudge at the Department of Housing and Urban Development, where I advise the Secretary on what HUD can do to make a difference for the populations that are most vulnerable in our nation and who need a combination of both housing and supportive services in order to achieve stable housing, as well as achieve improvements in other outcomes as well. One of the areas that we have been working hard to address are the housing needs of people who have been involved in the criminal justice system, people who are returning to the communities from prisons and jails, as well as those who have had criminal convictions and criminal histories for many years, where those criminal conviction histories continues to serve as barriers to their ability to access housing in the community. On the next slide, please. One of the drivers of our interest in this area is certainly a recognition of just data that shows the number of people. I think this will be spoken to, was mentioned earlier and will be elaborated on later, which is the number of people who experience housing instability or homelessness after leaving prisons and jails, as well as the number of people who we don't necessarily have data on, but who continue to face barriers to housing as a result of their having criminal conviction histories. We've held a number of listening sessions with our stakeholders, as well as with people with lived experience of criminal justice system involvement, and who have told us that there continues to be quite a few challenges to obtaining housing, either private market rental housing, or even HUD's programs such as public housing or voucher programs or other HUD-assisted housing among people who have criminal conviction histories. And as we've studied this issue more closely, what we found is that the current state of things is not working well. First off, we know that for people who are returning back to the community from prisons and jails, having stable housing is critical to their ability to successfully reenter the community, as well as to avoid recidivism, and also to have every other sort of factor that helps them to achieve successful reentry. How hard is it to find a job if you don't have a stable place to live? how hard is it to continue to engage in substance use treatment or receive mental health services if you don't have a stable place to live. And so housing is critical to successful reentry, and it's also critical to public safety. We recognize that housing plays a critical role in increasing public safety. At the same time, we find that when people are leaving prisons or jails or have criminal conviction histories, they often have very few housing options. And therefore, we are contributing to policies where the very people who could benefit from having the support that stable housing provides are actually often deprived of access to housing opportunities. Secondarily, we've also found that the way that many private landlords, third-party screening companies, as well as the agencies that administer HUD programs at the local level use criminal conviction histories as a part of their screening processes is often over-excluding people who have criminal conviction histories. People who've had conviction histories that are 30 years old and where there's been no other convictions or crimes or other challenges in that 30-year period continue to face barriers to housing as a result of their criminal conviction histories. People who have now become stably employed or who have been successful members of their community, participating in their faith communities or engaging in community service, are also still being excluded from HUD programs or from private market rental housing as a result of their criminal conviction histories. And so as we've looked into the screening practices of both private housing providers as well as HUD-assisted housing providers, we find that while we certainly recognize the importance of tenant screening and really screening for suitability, that oftentimes people are being denied housing simply because of the fact that they have a criminal conviction history, and where all of the other factors and circumstances, how long ago was that criminal conviction, what has happened since that criminal conviction, what are the other indicators of whether the person is going to be a successful tenant, are actually not being looked at. And what we found is that successful or actually screening people for suitability in housing needs to require more than just looking at a paper criminal record and making a yes or no decision based on just that record. Really, people are more than their criminal records and need to be looked at holistically. And so what our secretary has charged HUD to do last April was to conduct a systematic and comprehensive review of all of our regulations, our guidance, and all of our other technical assistance documents to ensure that we're finding ways to make our policies clear to ensure that people with criminal records should not be over-excluded from HUD-assisted housing programs. That means public housing, our voucher programs, our multifamily housing programs, all of the programs that HUD administers that provide low-income housing assistance to Americans, that we are doing everything we can to reduce those unnecessary barriers to our programs. So we completed that review as the secretary charged last October. And what we identified is a number of places where our policies are inconsistent, where on the one hand, we encourage a nuanced and an individualized approach to screening and suitability assessments at the point of admissions. But on the other hand, some of our policy documents and regulations continues to reinforce this message that criminal records can be used as an automatic disqualifier for HUD programs. And so we're having completed that review, we are now taking the next steps to amend our policies and make changes to make it clear that, again, criminal records should never be an automatic disqualifier other than a few mandatory exclusions. But in general, that people should not just be automatically denied housing assistance on the basis of their criminal records. And number two, that we want to support all of the agencies that administer HUD-assisted housing programs to use effective individualized screening and suitability assessments that, again, goes beyond just looking at a piece of paper or a criminal record and making a yes or no decision, but really looking at the full set of circumstances. We also understand that many public housing agencies, HUD-assisted housing providers are already undertaking those approaches. Many have already amended their screening and admissions policies. And so what we're going to do is ensure that we're highlighting those examples of agencies that are doing the right thing, looking at people as people, looking at people in an individualized way, and not just systematically kind of excluding and denying people just for having a criminal conviction history. And then the last thing I'll just say is that what we're doing to remove barriers to our programs is just one of the things we're doing. We also are working in partnership with many of the agencies that are presenting on this webinar. Steps being taken to use public housing or homeless assistance programs to proactively assist people who are returning to the community, and partnering with many of you, criminal justice agencies, corrections agencies, reentry programs, on ways to combine housing and supportive services to help meet the needs of people who are returning back to the community from incarceration, so that we can ultimately prevent their homelessness and maximize their housing stability. And if we do all of that, we know we will be contributing to greater public safety in our whole communities. As I want to remind folks, HUD is more than housing. We are also about urban development. We are also about making our communities safer. And we see supporting successful reentry, including through housing, as key to increasing community safety and public safety. So with that, I'll turn it back to you, Dr. Stein.
Thank you so much, Dr. Cho. Really exciting to hear the update going on at HUD, and looking forward to seeing more come of that work. Now we are going to turn over to our presenters from the Council for State Governments Justice Center, and I will hand things over to Dr. Aisha Delaney-Bumsey.
Thank you so much, Dr. Stein. Go to the next slide. I just want to first acknowledge the Bureau of Justice Assistance for supporting my team's work on this webinar. BJA is the agency that seeks to strengthen the nation's criminal justice system to help communities across the country prevent crime, reduce recidivism, and promote a fair and safe justice system. Next slide, please. And next one. So you heard this from the two opening speakers, but what we know from research and what many of us in this virtual room know from our own practical experience is that safe, affordable, and permanent housing is the bedrock for well-being and stability. And it's fundamental to keeping people out of the justice system. Unfortunately, though, the fact that people have a history of justice involvement actually makes it far more difficult for them to find housing. And that's due not just to the lack of affordable housing across the nation, but to the stigma of justice system involvement from landlords and lenders, and to a host of legal and regulatory restrictions that prohibit people from accessing housing because of a criminal record. And in fact, I was just looking this morning at the National Database of Collateral Consequences, which tracks these types of laws and regulations, and found over 1,000 in the US right now. So I just want to say that I was really excited, Dr. Cho, to hear about the work that HUD's doing to address some of those barriers, and really applaud that work. We also know that for Black and Brown people who have higher rates of incarceration and homelessness and who face racial discrimination in the housing market, these types of challenges are compounded. Next slide. And this isn't a challenge that just touches the housing system or the criminal justice system. We also know that people experiencing housing instability and homelessness are more likely than other people to have unmet behavioral health needs. So because of this, they're likely to come into contact with multiple systems, emergency housing, the medical system, and can frequently cycle between those systems. And this kind of cycling can be compounding and have a really disruptive impact on people's lives. Therefore, and we'll discuss this further in the webinar, effective reentry housing initiatives are often built on a foundation of structured collaboration across those systems between justice, health, housing, and behavioral health systems. And that structured collaboration is meant to maximize the limited resources from each system and capitalize on the idea that these systems have a common mission and are serving a common group of people. Next slide. Collaboration is especially essential because what we know is that it's not just that being homeless places people at risk for justice involvement or vice versa, it's really a cycle. People experiencing homelessness, particularly people experiencing unsheltered homelessness, are more likely to encounter law enforcement due to a number of factors, but in part because they're living their lives outside. They're sleeping, they're using the bathroom, they're using substances outside. And once they've been arrested, we know that people who are homeless are less likely to be diverted away from incarceration. judges are reluctant to release people who are unstably housed into the community while they wait for trial, fear that they won't return to court. And if the judge sets bail, people who are homeless are less likely to be able to pay that bail. They're also less likely to be eligible for diversion programs that serve as alternatives to jails and prisons, and so on and so forth, driving people deeper and deeper into the system. So combined with the many barriers to housing access that already come with the history of a criminal record, this dynamic really leads to that vicious cycle of housing instability and justice involvement. And so one of the best ways to break that cycle is to connect people to housing upon release from jail or prison. And so today, we're really pleased to share with you a framework to build that partnership, that infrastructure, and the resources that support this work, as well as share with you a story of how criminal justice, behavioral health, and housing partners in Ohio have followed these steps to launch and sustain a model program that meets reentry housing needs. And now, I think, Charlie, I'm passing directly to you.
Thanks so much, Aisha, for setting the stage for this important conversation. So we've already heard, about this unfortunate and all too frequent cycle between housing instability and justice involvement, the barriers so many people face, in accessing housing after they've been involved with the justice system, and some of the great work that HUD is, spearheading to try and really change this trend and stem this tide. And so what I'm going to talk about now is sort of a framework and some best practices, based on what we've been seeing around the country, what works to bring these systems together, housing, health, behavioral health, and criminal justice, to increase access to and availability of housing and really help break that cycle. But before I get there, I just want to zoom out here for a moment, just so we can really understand things in the big picture. So just a couple of statistics here, just generally on the prevalence of mental health and substance use disorders among the prison and jail populations. And these are drawn from several of some of the most recent national studies in the last 10 years or so. And you'll see that in terms of prevalence of mental health disorders, close to half of all people in both prison and jail populations have ever received a diagnosis of a mental health disorder. And then around half or a little more of half of folks in federal, state prisons or jail meet the DSM-4 criteria for a substance use disorder. And I don't think that is surprising to anyone on this webinar, but I mean, just to really set the stage that, it's just an incredibly important dynamic, but it's something that is incredibly important to address through access to housing that's really tied into people's needs. And so drawing in a little bit of our own original research, looking a little bit deeper, this slide is drawn from some work that we did in California a couple of years back. We did a report. We pulled together some recommendations for the State Council on Criminal Justice and Behavioral Health, looking at what would be the most impactful strategies to increase access to housing for people living in prisons and jails. And as part of that work, we did some original analysis of prison and jail data, both in California and some other peer states as well too. And basically what we found is that, looking at these two groups of people here, about up to 25% of people, in jail may need some form of ongoing housing assistance, and varying levels of mental health services. But the important thing is varying levels of both housing assistance and services. And that's a theme that's going to come up again and again, because both housing resources and service resources are limited. And so it's very important to connect people with the right services and the right housing at the right time. And so this is just to kind of tee up that conversation. for some of the slides that you'll see in the rest of my presentation. So just to make sure that we're speaking the same language, again, there are different key permanent housing types for different needs. One of the most important housing types for the population that we're looking at here is what's known as permanent supportive housing, which many of you might be familiar with. It's affordable housing, without time limits, and that provides wraparound supportive services that they might be provided on site or otherwise closely connected to the housing. And permanent supportive housing, it may be located in a single building, or it may be what's called scattered site housing. So, people may be living in, small multi-unit buildings or even single unit buildings with close connections to supportive services. Generally, the target population for PSH are people with high housing and criminogenic behavioral health or other healthcare needs. So these are generally the folks with the highest level of needs. And that's important to keep in mind because, PSH is a very valuable and important resource, but it's also not for everyone. Another very important housing model for this population is what's called rapid rehousing. And rapid rehousing actually encompasses a number of different things. It's almost, sometimes I like to think of it as almost more of a concept. It refers to the idea of providing an individualized package of financial assistance and services to help connect people to housing and establish stability. What do people need in the short to medium term to connect with and stay housed, to kind of get them over the hump? It might be a short-term rental assistance, security deposit funding, paying overdue utility bills, landlord mediation. It could be a whole number of things. And they may need to transition into supportive housing, or they may transition into market rate housing, or a number of other housing types. And finally, we have the much larger and more general category of other affordable housing. This can be tenant-based rental assistance, Section 8 vouchers, as well as public housing or privately owned subsidized developments. This is a much more diffuse group, but generally the target population is people who need a long-term rental subsidy, but may have lower supportive services needs. And then common service models, not just for PSH, but for PSH in particular, there is a lot of diversity, within the service models that are provided. You might have intense case management teams, multiple disciplinary teams, nurses, behavioral health providers, housing navigators, and so forth. Generally low case loads, different professionals that can be called on for supports. And then sometimes you may go up to the next level and have an ACT team, assertive community treatment. Definitions of this can vary, but generally available 24/7, may include peers, doctors, and social workers with even lower caseloads. But generally their PSH will have these different levels of intensive services that are closely available to people. And PSH has also been very well studied, which I'll get into in the next few slides. And just an important thing to note is that whether you're looking at sort of an urban, more concentrated community, or a rural community, maybe where the services are provided in a more diffuse and more scattered way, both have been shown to be effective. Speaking of research, housing works. And in particular, providing housing with what's known as the housing first approach. And again, many of you may have heard of this before, and it is exactly what it sounds like, providing housing without preconditions such as required engagement in services, mandatory sobriety, etc. It can sometimes be counterintuitive at first, particularly if you're coming, from more of a criminal justice lens. But the approach, particularly housing first as is connected to permanent supportive housing, has been pretty rigorously studied. And the results are very good. People generally come into less contact with law enforcement, reduce returns to prison and jail, and it saves money. It's certainly not free, but there have been a number of studies that have looked at reduced costs to jails and prisons, to emergency departments, shelters, and so forth. And of particular interest to this call, in these housing first, permanent supportive housing type programs, we'll often see increased participation in services. Because when housing first is done well, service participation isn't required, but it's assertively offered and very closely available. And that really makes all the difference. And then just another quick slide on the research. Housing really makes difference for families as well too. Several years back, HUD did what's called the Family Options Study, where they followed a group of families that received different interventions, no housing interventions, a subsidy only, and then subsidies with various levels of supportive services. And I won't go deeply into the details, but the families that received these more intensive housing interventions had greater levels of family stability. Families stayed together for a longer period of time. Children scored higher on pro-social behavior scales as well, among a number of other outcomes. And then other studies showed similar outcomes, such as improved parent-child relationships. Again, housing works. So just setting the stage in terms of some of the statistics and what the research says, we know housing works. And, if there's one thing that we have heard from our criminal justice partners across the country, is that one of the toughest things to solve for is helping folks access stable, safe, affordable housing after they've been involved with the criminal justice system. Because really what that requires is building partnerships, access to resources, connecting people with the right housing and services at the right time so they don't fall through the cracks. And, so they can realize all these great outcomes that I was just talking about. But, it takes a lot to be able to do this. And so over the last several years, we at the Justice Center have been looking at, what are communities that do this well, whether it's a city, a county, or a state, what do they have in common? What works? And so we've put these steps together into what we call the action points framework. And this is a piece that's featured on the HUD Exchange technical assistance page that was referenced earlier, entitled Reducing Homelessness for People Leaving Prisons and Jails. It features this and a number of our other resources as well. But this is kind of the foundational piece. And it's 4 steps to expand access to housing for people in the justice system with behavioral health needs. And these are the 4 steps. Step 1, collaborate. Partnership building across the different systems we've been talking about has been fundamental to every successful housing intervention that we've seen that serves people who are involved with the justice system. Assessment. This is why I started with those data slides. Housing and supportive services are in limited supply, and there are different models to meet different needs. We need to connect people with the right services and the right housing. And these connections, especially if people are just leaving the justice system, those initial days, weeks, and months are so critical, and we need to make those connections with the mainstream housing system. But then ultimately, and this is sort of the long game, there's just not enough affordable housing in almost any community or state in the US. So at the same time, we need to be growing the pie and expanding the availability of housing. So those are the 4 steps of action points. And when we put out this brief, it was initially guided towards, state decision makers, but it really works at any level of analysis, whether you're looking at state or local, whether you sit within the criminal justice system, the housing system, the behavioral health system, a lot of the principles really hold up. And so I'm going to take you through each of these steps now, kind of talk you through what a couple of the action steps might be within each one of them, and share an example of a community that really has done each of these well. So step one, collaborate. What does this look like? For one thing, ensuring cross-sector representation in key planning bodies. So for example, the local homeless assistance continuum of care. For those of you who don't know, that is a planning body. So HUD funds, most of the homeless assistance activities in any given community, whether it's housing or services assistance through the continuums of care. And it might be state, local, or regional body, typically led by a nonprofit lead agency, but that can vary quite a bit. But, they are charged with, planning on a community level for, to meet the needs of the local population who's experiencing or at risk of homelessness, and deciding who is prioritized for HUD-funded homeless assistance programs. And they have a board who makes these decisions. And so one of the first steps, towards collaboration is making sure that folks from the criminal justice and behavioral health systems are sitting on the COC board. So you're at the table when these decisions are made. And this cross-sector representation applies to other planning bodies too, such as criminal justice coordinating councils. You also want to formalize these collaboration mechanisms. For example, data sharing is very important. Aisha was talking earlier about how behavioral health, criminal justice, and housing systems often serve many of the same people. And the more that you can bring together the data from these different systems, the more you can really quantify, capture that. And also facilitating regular cross-systems training. It sounds so simple, but one of the most foundational things you can do is making sure that people, we facilitated a training in California a few years ago for regional parole offices and continuums of care, just to help each side to sort of be able to speak each other's languages, learn what resources were available and what their roles were. And it ended up being really impactful. That kind of thing, there's really a hunger for it, so these are the kind of foundational things that may not have an immediate impact, but underlie the rest of these steps. And so one community that's done that really well is the state of Ohio. The Attorney General's Task Force on Mental Illness. This group has been active for over 10 years. It's chaired by a now retired Justice of the State Supreme Court. It includes folks from Stepping Up Ohio, and Stepping Up is a program that actually we facilitate, but there's also some state chapters as well too that basically brings together people from different systems to reduce the prevalence of people with mental health conditions in county jails. And so it includes people from Stepping Up Ohio, State Behavioral Health, Housing, and other agencies, really focused on cross-systems planning. And there's been a major housing focus. It has informed the development of numerous housing projects, but one of their most recent outcomes is because of this collaboration, they worked with the State Housing Finance Agency and some local partners to launch a landlord incentive program specifically targeted towards people who've been involved with the justice system. And that has been piloted in multiple counties now, and it's one of the first examples of a landlord incentive program specifically targeted towards this population in the country. So step 2, assess. It is so important to understand, particularly if you're looking at your prison and jail population, who is at the most risk of homelessness upon release. And you want to have tools where you can really assess that risk. But especially if you're looking at a jail environment, people are strapped for time and resources. So you need to have efficient, quick screening tools that can get this information, and you can use that to make connections with the mainstream housing and services system. And also, you want to develop the buy-in and the infrastructure to report this data publicly as well too. So it's a simple concept, but it's so important because one thing we learned in our California work and in some of our national work as well too, is that I think many of us intuitively know that, there's a high level of housing and service need among people who've, been to prison and jail, but so much of it still needs to be quantified to make the case for investment and connections to housing and services. So one place that has done this really well is Sonoma County, California. They've leveraged a grant through the Department of Justice, Bureau of Justice Assistance, Justice and Mental Health Collaboration Program. And this is done through their probation department. And so what they've done is it's a pretrial diversion program. So they've used this grant to develop screening and assessment tools and increase their staffing resources so that they are able to assess people's housing needs and engage in housing, connect people with housing, help with housing search, navigation, to really connect people with housing and provide stabilization and follow-up services, including supportive services, as an alternative to jail incarceration. And that program has been really successful. It's kept a number of people out of jail. And actually the JMHCP grant recently ran out, but they were able to, because of the success of the program, they were able to secure continued funding through federal American Rescue Plan Act money, as well as county funding, because county leaders really understand the value of that sort of investment. So step 3, connect. This really encompasses multiple points of connection. One aspect of this step is facilitating outreach efforts, because when we're talking about people who are involved or at risk of involvement with the justice system, we're not just talking about people who are leaving prisons and jails. We may also talk about people who are experiencing unsheltered homelessness, who, as we know, are at higher risk of justice involvement or may have been involved with the justice system in the past. And so part of this step is really being able to facilitate good outreach efforts, whether that is reimagining the role of law enforcement, community-led outreach efforts, et cetera. It's also opening wider the front door to the continuum of care coordinated entry system. And basically what coordinated entry is a system, it's a community-wide system of prioritization for HUD's homeless assistance resources. You can access coordinated entry in a number of ways. There might be a hotline, there may be intake points at shelters, different behavioral health providers. But thinking more widely about this, maybe there's an access point in a jail or as part of a homeless outreach team, et cetera, really being able to meet people where they're at. And then finally, another facet of this step is facilitating policy level conversations among housing agency leaders. And again, to use the COC example, a big part of what the COC board does is decide how different populations are prioritized for limited HUD homeless assistance resources. So in having those conversations, if you have people from the criminal justice and behavioral health and housing systems all at the same table, it's more likely that you will arrive at a decision, say, to target more resources to people who've been involved with the justice system in the past. And so a community example for this step is Sarasota, Florida. So they have a law enforcement homeless outreach team that has been active for a number of years. And, Sarasota was once known nationally as the meanest city in America for the homeless. They had a really bad and draconian reputation for a number of practices. But they really reimagined the role of their officers. They built relationships with their COC. They really moved away from enforcement and focused on building relationships, connecting people with services, and they even developed a relationship with the Salvation Army where they had dedicated beds where they could bring people and those were actually connected with some vouchers at the local housing authority. And by doing this work, they were actually able to reduce homelessness, as measured by HUD's point in time count, by over 50% in just 3 years. And then my final step here is expand. This can encompass a whole range of things. And this is, housing development is a very large and technical topic that we don't really have time to get into here. But, in terms of this framework, some important steps to keep in mind are, under step 2, we're really focusing on the value of cross-system data. You really want to use that data to be able to advocate for increased investment. You also want to think about how can you leverage no-cost and low-cost resources to increase the availability of housing. For example, in a number of places, old motels, hotels, or other institutional buildings are being repurposed into affordable housing. It's quicker and cheaper to redevelop these places. Thinking more creatively about how you can take existing stock in your community and repurpose it. Seeking non-traditional and private funding, philanthropic funding, for example, and in particular, managed care organizations and health plans are really increasingly investing in housing and looking at a social determinant of health. And finally, and very importantly, analyzing racial equity implications of development. As we mentioned earlier, there are profound racial inequities in both homelessness and justice involvement. And so if you're putting, new housing development efforts into place, you need to have evaluation mechanisms to understand which communities are benefiting from these development efforts. How are your referrals working? Who is being placed into housing? Bringing in people with lived experience to meaningfully plan these efforts. I mean, there's a whole suite of strategies you need to be putting into place to make sure that your interventions are having their intended effect. So finally, an example for this last step is Connecticut. So a few years back, they launched a rapid rehousing program. The Homeless Coalition and the Department of Corrections. It was a joint venture where they leveraged a foundation grant, some flexible funding from the Department of Justice, as well as COC resources to launch a rapid rehousing program for people leaving incarceration. So again, rapid rehousing, flexible package of assistance, security deposits, short-term rental assistance, utility bills, et cetera, that people could draw on in those early days, weeks, and months of reentry. So that is the action points framework, a scheme to be able to really put together, these different foundations of building partnerships, using data to connect people with the right housing and the right services at the right time, being able to connect people seamlessly with the housing and services that they need, and increase availability of housing. These are the steps that communities who are doing this work well have been following. And I hope that this was, a helpful overview, and I'll be more than happy to take some questions at the end. And now I'll pass it back to Dr. Stein.
Thank you. And now we will pass it over to Mr. Galley to begin some remarks regarding the work being done in Ohio.
Good afternoon, everybody. Happy to be here. My name is Chris Galley. I'm the Chief of the Bureau of Community Sanctions within the Ohio Department of Rehabilitation and Corrections. One of the duties of the Bureau of Community Sanctions is to contract for housing services. BCS contracts with halfway houses, temporary or transitional housing programs, and our contract with the Corporation of Supportive Housing, which you'll learn more about in a few minutes. I'd like to make 2 quick points from a Department of Corrections administrator perspective that I hope you'll find useful. First, permanent supportive housing is a very different type of program from your typical transitional, temporary, transitional type of housing program. The goal, as Charles mentioned, is stable, long-term housing. Therefore, from an administrative standpoint, you need to adjust your expectations of the number of clients served through these PSH programs. That doesn't mean it's bad. It just means that the number served will be much fewer than your typical 3 to 4 month transitional housing program due to the expected long length of stay. So, for example, in Ohio, a 50-bed transitional housing unit would be expected to serve approximately 150 to 250 clients in a year. A 3 to 4 month transitional stay upon their release from incarceration into temporary housing, get set up in the community, and then transition to a more permanent housing perspective. However, in a PSH model, the expectation would be for that same 50-bed unit would be that 50 or 55 clients be served within a year. So when I came into this position, it took me a little bit of time to really comprehend and understand that when looking at quarterly reports or annual reports, it's going to look different. That's fine. It's okay. You want the people housed for a year, for longer. That's the goal of the program. So I wanted to kind of underscore that, because when I came in the role and started dealing with permanent supportive housing programs, it did take me a little bit to really absorb and understand that. My second and last quick point from a Department of Corrections standpoint is that we certainly need as many of these housing programs as we can. Permanent supportive housing, rapid rehousing, transitional housing, housing on housing, you name the housing, we certainly need it. We need more providers to be willing to house justice-involved clients. So hopefully today can help all of us to continue to expand housing for the justice involved. And with that, I am happy to hand it to Janae Jenkins with the Corporation of Supportive Housing, who I'll put in a little 2-second plug. They are a wonderful partner for ODRC. We've been partnering with them since 2007. They do fantastic work. And so with that, Janae will discuss the further programs in Ohio. Janae?
Thank you, Chris. And as he said, my name is Janae Jenkins, and I am the Senior Program Manager for CSH, and I oversee the CTP program. Next slide, please. CSH, Corporation for Supportive Housing, which is a national organization, and our mission is to advance solutions that use housing as a platform for services to improve the lives of the most vulnerable people, maximizing public resources, and building healthy communities. CSH has multiple partners throughout the state of Ohio that work with the most vulnerable and difficult population exiting state prisons or jails. Our partners include State Corrections, which you just heard from Chris Galley, which is our Ohio Department of Rehabilitation and Corrections. The State Behavioral Health System, which is considered OMAS here in Ohio. It's the Ohio Mental Health and Addiction Services. It's our local county jail from Franklin County, and the Managed Care System CareSource. These partners have allowed for 4 great programs to be created throughout the state. Next slide, please. So what brings Justice Partners to the table? As many of you know, and as has been talked previously by other presenters, there are various barriers that individuals face when being released from incarceration. The individuals who have mental health, substance abuse, or co-occurring disorders, as well as felonies, are some of the most difficult to place in housing And other barriers are lack of landlords, units, stigmas from the community, no rental history or unfavorable rental history, credit, and income barriers. The housing programs provide scattered site housing throughout the state and wraparound services to address barriers and housing needs. These barriers have brought the partners together to the table to address cost effectiveness, the overcrowding, and avoiding growth in incarceration population, while allowing the opportunity for potential leverage for other sources and systems. Next slide, please. Corporation for Supportive Housing role is to design programs and provide ongoing sub-grant management. We have found through training the housing providers and case managers throughout the state, it enhances the program services. CSH trainings provides trainings on the Housing First model, harm reduction, motivational interviewing, trauma-informed care, ongoing data collection, management and reporting, on-site monitoring annually, discharge prevention, and continuous quality improvement. CSH also provides prison outreach and managed referrals into the programs. Next slide, please. CSH oversees the four following programs. The first one is the Returning Home Ohio, which is RHO program, which is funded through the Ohio Department of Correction and was established, as Chris said, in 2007, and currently has 220 plus units in 9 counties. The target population served for this program are those that are identified through ODRC that live with severe persistent mental illness or HIV positive, that are going home homeless or have unstable housing options upon release. The inmates qualify for the program pre-release or up to 120 days post-release from the state prisons. The next program is the program that I oversee, and it is the CTP Community Transition Program, which is funded through our Ohio Mental Health and Addiction Services, which is our state behavioral health system. CTP was established in 2017 and currently has 200 PSH units and 85 rapid rehousing units in 60 counties. The target population served for this program are those that have participated in recovery services while incarcerated. During incarceration, the inmate is given an assessment that is called the JDVI-SPDAT, the Justice Discharge Vulnerability Index Service Prioritization Decision Assistance Tool, which determines the type of housing the person may qualify for in order for the person to be housed. In order for them to be housed, they have to score at least a 4 and above on the assessment to determine if it's rapid rehousing or PSH. Typically, the individuals live with dual diagnosis, substance abuse disorder, as well as mental health or physical health issues. The inmates qualify for the program pre-release or up to 120 days post-release from the state prison. Our next program is the FUSE program, JRR, which is funded by Franklin County Office of Justice Planning and was established in 2019 as a state prison diversion program. We serve 40 people in Franklin County who have had at least 150 jail days or 5 stays in prison for the women or 8 stays in prison for the men in the past 2 years. These individuals have a behavioral health need and are considered homeless or have housing instability. JRR also uses the JDVI-SPDAT and targets individuals in drug court. And our last program, which is our newest program, is the Fresh Start program, which was funded through our managed care system, CareSource, and was piloted in 2020. We house 30 people incarcerated in Franklin County Jail with high risk for COVID morbidity and behavioral health needs. Next slide, please. Outcomes. RHO and CTP have some astounding recidivism outcomes. Less than 5% of the participants exit the housing program to state prison year after year. CTP 3-year recidivism rate is 7% versus the 32% for the Department of Rehabilitation and Corrections. CTP and RHO are both serve moderate and high risk, which is determined through the ORAS, Ohio Risk Assessment System, which is a recidivism assessment tool given while the inmates are incarcerated to determine the probability of them returning into prison once released. Approximately 70% of the individuals housed participate in clinical services. That is very important. 70% participate in clinical services, and all services are voluntary, so they are not required to participate. CTP measured the retention in housing and found that 95% are still housed at 12 months. The average length of stay in the program are under 2 years, and the majority of exits are positive. We measured the RHO and CTP, and out of 208 exits, only 32 exited to incarceration, being jail or prison, and 471 remained housed at the end of the year. Out of the 679 households served, 95% was successful. Next slide, please. Meeting the needs of the justice system, these programs serve the most hard-to-place violent offenders, sex offenders, arsonists, and etc., and do not refuse any background as long as they meet the program criteria. These programs are also cost-effective and meet the needs of the justice system. The daily rate for a halfway house is $67 a day versus supportive housing, which is $46 a day. Next slide, please. Well-being of the tenant. The program provides case management services, which works on the well-being of the tenant. The chart listed is for the program year 2021, where the performance on income integration goals. The blue shows the goals and the green is the actual. So as you can see, the rate of employment goals were 30%, but actually 18% were employed, which was lower than the actual goal. But it was also during the time that COVID was going on, so employment was harder to obtain. The receipt of income goal was 65%, and 65% actually have income, mainly Social Security. Increased benefits goal was 80%, and the actual numbers were 94%. Meaningful activities, which are activities in the community, reuniting with children, family, friends, church, and other community organizations. The goal was 60%, and the actual percentage was 75%. A quote by one of the CTP attendants, her name is Shanda, says, "I had some setbacks, but my support system and CTP helped me reach my goals. My motivation is a big part of my success, but I needed the help of my family, this program, and my recovery support team. So having support and case management services works." Next slide, please. Our other program is the Fuse Jail Recidivism Program, the Fuse program. The other program we run are for individuals coming out of jail, not prison, and is the Fuse program. As you can see, the pre-housing jail placement, the average person spent 105 days in jail. Once they were housed, it decreased to 25 days in jail. Next slide, please. CSH and other partners are excited to announce that we have launched a randomized controlled trial with the Notre Dame through DOJ's Second Chance Act in March of 2023 for the RHO and CTP programs. The study will have a control group members and a treatment group members that are looked into through the end of the study, which is March. The estimated time is March of 2026. The treatment group members are counted as treatment regardless of their participation and housing status through the end of the study. Franklin County Fuse had started a randomized control trial, but unfortunately had to suspend it due to the pandemic. There have been many other rigorous evaluations on the Fuse program, in Denver, Oregon, LA, and other programs. This study will control and treatment groups that will be matched against the HMIS, state wage records, and the Medicaid and CCIS. Next slide, please. Before I end, I wanted to share a story of one of our CTP participants. Her name is Angela. Angela went to jail at a very young age and served over 20 years in prison, including 12 months in solitary. Angela was considered one of the most difficult inmates to serve while she was incarcerated. As she stated, she was a terror. When CSH shared with the state corrections staff Angela's story, they were shocked. They considered her a troublesome inmate, but she has now become a model citizen in the community. Before being released, Angela said she was terrified and she had no support from family or friends. Angela was housed with CSH and our community partner Eden in Cleveland. She is working hard on her recovery from mental health and addiction with other community partners frontline and has been stably housed for nearly 3 years. The most stability that she says she has ever had. Today, she has started her own cleaning business and serves as a key advocate in advocacy roles for CSH planning and advisory committees where participants are able to give their input on what works and what needs to be reviewed in programs. We are proud to work alongside with Angela and are hopeful and encourage her to continue her growth for her future. She is only one of the many stories that have been affected by our program. So housing is a human right and should not be a reward. Thank you for allowing us this time to speak on the programs offered in Ohio, and I now turn it over to Charlie.
Thanks, Janae. Before we get to our Q&A, I just wanted to share a few of our Justice Center resources that can help you dig further into these topics. So as I mentioned earlier, the new HUD resource page just launched last year on preventing homelessness for people leaving incarceration, featuring our resources. Link here, and this will be in the slide deck that will get sent out to the Gaines listserv as well. And then our action points brief is also featured on that same page, as well as our website. And then also, so on the CSG Justice Center website, you can navigate directly to our housing topics page, and that'll connect you to a whole wealth of resources. An example is some of our recent explainers taking the action point steps a little bit further in terms of how to put them into practice to create new housing opportunities. The first two have been published. The system-wise change will be published soon. But this goes a little bit more in depth into some more community examples of how this work has been done. We've got the links to the first two here that will be in the slide deck. And then we also will be publishing this report in the next couple of weeks. We have done some work, a national questionnaire for Departments of Correction reentry coordinators, looking at what they're doing around reentry housing, what's being funded, what are the current policies, programs, and gaps to really understand that landscape. So we're really excited to put that out, and that should be available on our site. It says January 2023. It's actually going to be March 2023, but keep an eye out for that as well. And then finally, very excited about this because we just put this out about a month or two ago. We have a video highlighting the voices of people with lived experience with justice involvement and homelessness, and really illustrating some of these collateral consequences and stigma that we were talking about earlier, and showcasing different organizations and solutions doing this work. It's really powerful, I think really tells the story. So I think if you take a look at any one of these resources, probably make this one the one. Thank you, and I will pass it back to Dr. Stein for our Q&A.
All right. Thank you. And thanks so much to all of our presenters for sharing this information, their stories. And so we've got a little bit of time to cover some questions. We certainly won't get to everyone, so I apologize in advance if we are not able to get to your question. I do want to just open by saying Dr. Cho had to step off this event, but did welcome us to send him questions that were directed towards him. So we will take in consideration questions you've submitted for Dr. Cho and see if we're able to get some responses for some of those questions. If we are, we'll share those with the slides or any follow-up materials that we disseminate. So to get into some of the questions that were directed towards our presenters still on the line, and as a reminder, if you'd like me to select a question, if you'll pop it in the Q&A, that's easier to track than the chat. So just pop them in the Q&A. So let's see, there are a lot of questions here. I'm just going to kind of go through a couple that have come through. One came through specifically for Charlie. And someone was asking, can you provide some concrete examples of continuums of care that partner with prisons or jails to help with homeless, those who are homeless with a history of incarceration or upon exit of incarceration? So I just wanted to see if you could provide more concrete examples of continuums of care that have jails or prisons as part of that continuum.
Yeah, absolutely. I was hoping you'd call on that one. So the first one that comes to mind is Albany, New York. They have a longstanding rapid rehousing program for people who are leaving state prison incarceration. And that's the lead agency there is the Homeless and Travelers Aid Society. So that's been a longstanding program. I know they've been looking to expand that recently. They have that as well as other, they really do a good job of prioritizing that in their COC, which is not always easy, especially, given some of the nuances around HUD's definition of homelessness and needing to prioritize, chronically homeless folks for certain programs. I think also what we're seeing a lot more of, partially due to HUD's recent efforts, that Dr. Cho was talking about, and particularly the new emergency housing voucher resources that have been made available through the ARP, which are really a collaboration between housing authorities and COCs. We've seen a lot of COCs step into this lead role to really prioritize people in reentry for these vouchers. A great example would be Austin and Travis County, Texas. They've really been at the forefront of this work. So those are two quick examples, happy to share more as well.
Thank you. So we did have a question come in for Ohio, and it was about funding. People always want to know more, get more ideas around how do we fund things. So I know that some preliminary information was provided, but would it be possible for the Ohio team to go through each of the programs that were presented and give a little more detail as to how those programs are presented, or if there's any co-funding, rated funding, just to give our attendees some ideas of some potential funding streams they could pursue.
So Janae, I'll take it, I guess, a little bit first. The Returning Home Ohio program is funded through a direct contract between DRC and Corporation of Supportive Housing. So it is just our general revenue, Ohio, it's Department of Corrections funding that comes through the Bureau of Community Sanctions, and we contract with CSH. And then I think their second portion of that question, I just lost it, was, I lost it.
Sorry, I was doing some housekeeping behind the scenes. The second question was, what type of housing partners are involved and what requirements?
So that would be Janae. So we contract with CSH, and then CSH goes and finds the actual housing providers. So go ahead, Janae.
Yes. So ODRC contracts for RHO. CTP is Ohio Mental Health and Addiction Services, and they contract with us. And then we put out an RFP to contract with housing providers throughout the state. We have 10 in CTP, 9 in RHO. And then we also have them partner with mental health services for case management services. Some of our housing providers actually have case management within their agency, mental health services and case management within their services, within their service.
Okay, thank you. We have gotten a couple of questions around working with landlords, and that wasn't a specific focus of our webinar, but that is a significant issue that people grapple with. So just wondering, so across all three of you, any suggestions on connecting with landlords, building those meaningful relationships, partnerships? Yeah, anything else you'd want to provide around those connections with landlords?
So
I'll start with you, Janae, and then we can.
So with us, we work closely with our housing providers, and they actually, a lot of our providers actually do what's called a landlord lunch and learn to present about our programs, the outcomes of a lot of our clients, and the landlords working with them and keeping a close relationship. So for CTP, they're called housing brokers. They actually have to have regular contact with the landlords to keep that relationship going, which has truly helped with keeping our clients housed. Because if there are issues, the landlords feel comfortable enough to reach out to our housing brokers to say, hey, we're having issues, so that then there can be a meeting among the landlord, the housing provider, and the tenant. So definitely relationship building. I have a couple of programs that actually they are doing a video on what the program is about so that landlords can see. A lot of it is word of mouth. One landlord tells another landlord. Then there's also certain communities have landlord meetings once a month. So that is a time for that our housing brokers can go into those meetings and talk about programming. So relationship. I can't say that enough.
Charlie or Chris, would you like to add anything else to that?
I think Janae hit the nail on the head. It is absolutely all about relationships. I mean, if you're a landlord, you mainly want to make sure that your rent is paid on time and you have somebody to call if something goes wrong. It's really more about peace of mind than anything else. And I think, that's exactly the type of thing that Janae is talking about. And there's also, in some cases, we've seen financial incentive programs work particularly well in some cases as well. I was talking a little bit about that, and some rural counties in Ohio are piloting that. We've seen a lot of that, not necessarily specifically with justice involved folks, but, it kind of helps certain programs, become more competitive with private market rents that are rising. Also, a lot of landlords, particularly, small-time landlords, may need some extra money to fix up their properties, make repairs, that sort of thing. So, in addition to the relationship aspect, financial incentives, or what are called risk mitigation funds. Some counties and municipalities have basically insurance claims that they can draw on in case of damages or people leaving early. So there's really a whole toolbox of strategies, and we're really seeing these things really mushroom nationally. So I think you'll continue to see more and more relationship building and incentive strategies.
Chris, anything you would like to add?
No, I can't add too much more than that. We've been fortunate that most of our contracts with the not-for-profits that we have been in place for long term. I will say it has been a challenge to add new folks. So we're happy that we're hanging on to the ones that we have, and certainly when they can expand, we do what we can to find the funding to be able to do that. But we've run into challenges with trying to expand and provide and find more providers.
Thank you for that. I also just want to draw attention to comments in the chat. So many of you sharing resources, sharing your emails, asking, if you're in New Jersey or if you're in Arizona, please contact me. So I hope that you all will look through, take advantage of the resources and contacts being shared through the chat. And if you right-click, select all, and copy, then you can paste the chat to a Word document and look through it at your own leisure after the webinar. Because the chat does go away when our webinar closes. But we do want to just move on to a couple of our closing slides. Again, just thank you so much, Janae, Charlie, Chris, for your presentations today. Obviously, from the chat and everything going on, people taking it all in, lots of information shared that we really appreciate. So folks, some of you are waiting for a certificate of attendance. It's going to be dropped into the chat right now. So what you'll want to do is click on that and follow the prompts to download that to your computer. And then you will be able to fill it out and have this certificate of attendance for your personal portfolio. And then we'll move to the next slide. We've got a number of other webinars on SAMHSA's YouTube channel around housing. So if you want to take a screenshot of this, or if you want to wait for us to send the slides out to you later, please do take advantage of these resources, some more really helpful information from these previous webinars we've been doing since 2019. So there's a list of 4 other webinars you can access on your own time. Next slide, please. We've also just had a poll pop up. Would really appreciate your input if you want to give more feedback regarding this topic and future work that the Game Center could do. If you haven't signed up for the Games listserv, here is a QR code or also a shortened URL that you can enter into your favorite browser, and you can sign up for the Game Center's listserv. Thanks, Ashley. Ashley just dropped the link in the chat. Here you can stay in touch with the Game Center, all of the webinars we'll be doing coming up. We do publish a monthly e-newsletter with more information around various topics of behavioral health and criminal legal involvement. Next slide, please. And so if you do have any further questions that are just burning on your mind that you have not had a chance to have answered through today's webinar, feel free to reach out to the Game Center. We certainly want to be a resource to support folks. So you'll see at the bottom of the slide here, we have the Game Center's email, URL, website address, as well as a direct phone line if you would like to contact us for more information or support. So with that, I just want to say thank you again to our presenters for their time and the expertise that they shared with us today. We really appreciate it. As also just a special thank you to Charlie for his work in helping us organize this whole event and pull this wonderful panel of presenters together. So thanks so much to everyone. We're going to leave the webinar open until the top of the hour for those of you who need to download your certificate of attendance. So thank you so much. Hope to see you at the next Games webinar.
Thank you, everyone.